Let's talk about how the government broke the healthcare system twice. I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my videos, like, share, and follow. First, they let the opioid crisis happen through underregulation and corporate greed. Now they've swung the pendulum so far the other way that people who actually need help are the ones being punished. It's a scandal that isn't getting enough airtime. Now, for years, big government, well, they looked the other way when pharma companies pushed the pain as a fifth vital sign narrative. They paved the road to addiction with under-regulation. But instead of a surgical precision to fix it, they used the typical sledgehammer. They created an environment of fear where doctors are terrified to treat pain. Now, look at the solutions. They're forcing every doctor, people like me, who might write 2 prescriptions of opiates a year, to take a mandatory 8-hour course just to keep their DEA license. It's painful and it's stupid red tape. It doesn't stop the fentanyl on the streets, but it does create a chilling effect. Now, I'm seeing primary care docs stop prescribing entirely because they don't want a target on their back. People are afraid to prescribe opiates to those who need it. The result, as I just mentioned, we have pain refugees. Patients who have been stable for a decade are being forced to taper or abandon their medicines. And when a legitimate patient can't get their medication, they don't just stop hurting, they lose their jobs, their mobility, and sometimes their lives. It causes depression, of course. Now, we've traded a prescription problem for a street fentanyl nightmare and a patient abandonment crisis. We need a call to action here, folks. We have to stop treating every chronic pain patient like a criminal and every doctor like a dealer. We need advocacy that demands balance, not just more bureaucracy. If you've been affected by this swing of the pendulum, tell your story in the comments. We need to be heard.